Now, in case of this alpha 2, I have the adrenergic receptors, okay, that are, okay, kind of just grab this concept that we also call this mechanoreceptors. If anywhere you find this word written, just take it at they're talking about adrenergic, okay. Now, alpha 2. Only remember one word with alpha 2, that is inhibition. Inhibition. For everything, it just inhibits, okay, it's not stimulatory. So it has a function on the preganglionic fiber, okay. Now it will be better if I show you. I have the picture in the same book. Yes, I just want to show you this little end, okay. This is a picture from Lippincott Pharmacology, okay. I just want to show you this end. This is the pre fiber, okay, or I can say the preganglionic fiber, okay. This is the synapse, or we can call the synaptic cleft, the synaptic space, and this is the membrane of the post ganglionic fiber. Now you see acetylcholine, the norepinephrine is released from here, and then it is going downwards to stimulate the other neuron, but it is also coming back to the same nerve, and we have a presynaptic receptor on which this norepinephrine is like getting attached to it. So what is the function that is going on over here? When it kind of attached to the same receptor on the same neuron, that neuron has the receptor for it also. This is inhibitory function, okay. When your norepinephrine is released more and more, and there is a lot more in over here, some of it goes and stimulate the other neuron, but when the quantity of norepi is more in the synaptic space, you see some of it bind to this presynaptic receptor, giving the signal to this neuron that we don't want it more. Stop the production. This is inhibitory. And this receptor is alpha 2. It is not written here, but this is alpha 2. This is the alpha 2 receptor. Okay. We'll come back to this picture and we'll study this whole picture because it is of pharma. But for now, I have made this, but I kind of want to show you over there. Okay. Now, how it works, all that mechanism of adenylyl cyclase and cyclic AMP, just hold on to this concept and we will go back once we finish this receptor functions, okay? Just hold on to this concept. For now, you just only need to understand that how this, the location of this is working in inhibition of norepi release, okay? Then we have this on the walls of GI tract, okay, and I showed you that the parasympathetic effect of GI that was receiving the vagus, okay, that was receiving this vagus nerve. The receptors present over here that are inhibiting the function are alpha 2. So these are alpha 1 and these are alpha 2. Getting my point? Okay, and we know that because inhibitory function is of parasympathetic on the GI tract, that is the vagus nerve will release acetylcholine. It will not release epi or norepi. Okay, let's go back to this picture to make this concept even more clear. This vagus nerve is parasympathetic. It will release acetylcholine at this particular level, at the preganglionic end, and also at the postganglionic end. Both of the areas, acetylcholine will be released, and because this is doing an inhibitory function, the receptors present are alpha 2 and the release of acetylcholine is present over here. Okay. Similarly, if I talk about the sympathetic, you have alpha 1 receptors, and the neurotransmitter is api or norapi. Okay. So do not confuse or mix with this alpha 2 over here. Alpha 2 do have the actions on norapi and api, but it also decrease the release of acetylcholine. So in case when you are at rest, you know why? When your body digests food, when you are at rest, when you are working, or when you are running, or you're in stress, your body do not digest food. Your food is only digested when your body is at rest. So when it is at rest, the parasympathetic nervous system overtakes the sympathetic nervous system, and there this sympathetic receptor performs its function. Okay. And when you are at the fight and flight mode, and your food do not wants to get digested, okay, it just wants to stay at its place. So at that particular level, this alpha 2 also like kind of help in inhibiting the process by decreasing the acetylcholine release. So this is the mechanism. This is one more thing which you need to understand, that it has an inhibitory effect on this neurotransmitter as well. Then you have acetylcholine on platelet, alpha 2 receptors on platelets. Okay. Where, and like, it is not like kind of explained over here, written over here, but I may tell you that when you'll be learning pathology over there, this concept will apply, that how when you're injured and these platelets come and stick to your vessel wall and stop the bleeding process, there this alpha 2 receptors helps. uh, okay. They kind of inhibit the process of nitric oxide release and constrict your blood vessels, along with helping those platelets to stick at that place. Okay. Then we have this insulin, because from where this insulin is released? From the pancreas. We have this beta cells in the pancreas that are responsible to release the insulin, but alpha 2, as its inhibitory function, will inhibit the release of insulin, and what will be the result of it? The glucose level in your blood will increase. Okay. Also, we have the location on fat cells, and it will decrease as its inhibitory effect. It will decrease the lipolysis. Okay. Okay. At this particular level, because we are talking about fat cells, just grab this little concept that we have beta 3 also on fat cells. Okay. On adipose tissues, we have this beta 3. We only have beta 3 on adipose, like nowhere else. So just kind of make this concept clear. I'll share these notes. Okay. Now, when I'm talking about this beta 1, okay, the location is SA node, AV node, ventricle muscles of heart, basically the cardiac muscles of the ventricles of heart, okay, myocardium. So beta 1 is located at these particular levels. It is not present at the atrial muscles. That is what I told you when I was showing you this picture, and I repeated again and again that keep in mind that we, in the parasympathetic, atrial muscles are also over here, okay, along with SA and AV. And when we were talking about cardiac muscles over here and over here, okay, we are talking about the myocardium of ventricles along with the SA and AV node. So grab this concept from here, that like we are only talking about the cardiac muscles of ventricles but not the atrium. Okay. Then we have kidneys. I have already shown you a picture of kidney. Okay. So what is the function of beta 1? It is like the overall function of beta 1 on kidney and on heart is stimulatory. You see these up arrows, so it will increase the heart rate, it will increase the myocardial contractility. Also, it will increase the renin release in the kidney. Okay, now at this particular level, grab this concept of there are three terminologies which we use, and particularly when we will be studying the cardiac pharmacology, I will not be using these terminologies: heart rate, myocardial contractility, okay, and the conduction, also conduction velocity. I will not be using these three words. I will be using chronotropic, inotropic, and dromotropic. Okay, so remember that chrono is for heart rate, iono is for contractility, and then we have another which is not written here, that is dromo, and that is for the conduction velocity, the speed, the impulse, the electrical impulses of the heart, the speed it takes to fire and contract and relax the heart. Okay, all that electrical activity, that is the conduction velocity. So for that we use dromo word, okay, dromotropic. So whenever we say positive chrono, positive iono, or positive dromo, it means I'm talking about that all of these things are increasing. But when we say it negative, it means that these all things are inhibiting. Okay, so just grab this concept. Another way to remember is, usually people mix chrono with contractility. Just keep it that way, that you're not supposed to make C and C meet with each other. Okay, keep them separate. So chrono is not for contractility, it is for rate, and iono is for contractility. Okay, so the effect of beta 1 on heart is like increasing these things. Okay, and what will be the neurotransmitter? Definitely epi and norepi. Okay, also on kidney, it activates the renin, angiotensin, aldosterone system that we call RAS. Okay, in physiology, in the cardiac physiology, I will be teaching you RAS system. Okay, how it works. So for now, in pharmacology, you have to remember that this renin, angiotensin, aldosterone system is activated, and the end result of it is basically angiotensin 2. Okay, it starts from this renin release. Okay, and the last product which we get to increase this blood pressure is angiotensin 2. Okay, angiotensin 2. So now you kind of get this whole thing. Let's move to beta 2. When we're talking about beta 2, it is mix. Okay, but like mix as in sense that it's somewhere excitatory, but at some levels it is inhibitory. So you kind of have to gain this concept that at some levels it is inhibitory, and most of them. So when I'm talking about this vascular smooth muscles of kindly mute your mic, people. When I'm talking about this vascular smooth muscles of the skeletal muscles, okay, now people will confuse. Skeletal muscle and smooth muscles are two different muscles. Okay, skeletal muscles are of the muscles which you're using for movement of your body. Your upper limb, lower limb muscles are the skeletal muscles. Okay, your rib cage muscles are skeletal muscles. Your abdomen muscles are skeletal muscles. So those all are skeletal muscles. But we have blood supply of these skeletal muscles as well. So here we are talking about the blood supply. So those blood vessels have smooth muscles. Okay, the endothelial lining of blood vessels are of smooth muscles. So vascular smooth muscles of skeletal muscles is the location where we have this beta 2 receptors, which is helping in dilating our blood vessels. Okay, so the opposite mechanism, when we read alpha 1, above here, when we read alpha 1, it was having the vasoconstrictive effect that is leading to increased blood pressure. But now when we are studying beta 2, we have this decreased peripheral resistance that will decrease your blood pressure. So the receptors that are responsible for increasing your blood pressure is alpha 1, and the one for decreasing is beta 2. Okay, then we have bronchial smooth muscles, okay, that will cause bronchodilation. Okay, they are present at the level of bronchioles and bronchus. Okay, both bronchus and bronchioles. Okay, now grab this concept here that I told you about the GI circular muscles when we were studying alpha 1. Okay, and they were constricting it. Now the GI longitudinal muscles here, okay, they are dilating. Okay, they are like relaxing, not dilating, relaxing is the right word for muscles. They are relaxing, but they are not causing a parasympathetic effect. You know, whenever the food has to pushed forward, one muscle relaxes and one muscle contracts. Okay, so the longitudinal will relax and the circular will contract. So the action of pushing the food forward is both by alpha 1 and beta 2 together. Okay, so just keep these things in your mind. Then we have the beta 2 on pancreas as well. The location of beta 2 is more than any other. So beta 2 is present at most of the locations. It is also present on the pancreas. We have alpha cells, beta cells, and delta cells on the pancreas. Okay, so we read about the alpha cells that were secreting insulin, but the beta cells are secreting glucagon. Okay, and the release will increase. So beta 2 has a stimulatory effect on the glucagon. Okay, it is releasing, but an inhibitory effect, okay, when we talk about the glucose, because when your blood has more insulin, the glucose levels drops down, but when your blood has more glucagon, the glucose levels decrease. Okay, so it has an opposite effect with glucose. Then the detrusor muscle of the urinary bladder, it relaxes the smooth muscle of the urinary bladder. So when this muscle, the detrusor, will be relaxed, what will be the effect on the sphincter? Like, now you have to think, like, is it holding your urine or is it letting you pass it? It is relaxed. That means no pressure. No pressure, no urge. No urge means your sphincters will remain constricted. That this is an important concept. This is the most favorite MCQ in all board exams at all levels, the bladder. Now these muscles are relaxed. Okay, I will draw a backward arrow to make you understand. These are relaxed. That means no pressure, no urge. Your central nervous system is not getting any stimulus that you need to urinate. Therefore, these sphincters will remain constricted and you will not be passing your urine. So that means the concept of no urination is run by beta 2 as well. Okay, and we have read. Okay, so now here at this particular level, you have beta 1, okay, you have beta 1 here, and at this particular level, you have alpha 1. And they both are helping you in the no urination mechanism. That is the thing that you studied, okay? So people, I guess at this particular level, we will be like ending today's lecture. It's kind of gone 1 hour 30 minutes. Okay, I will be taking long lectures in the start, but once you get the idea of how these things work, it will be easier for you to grab the systemic pharmacology. Okay, so our next topic, we are kind of like reaching again 40 minutes. So you have taken 40 minutes, 2 lectures right now. So we kind of, the next topic which we're gonna study from this first aid will be the receptors. So I will just leave this part, okay? I will just leave this part right now and kind of like complete this with you. So you like kind of understand this whole picture and understand this line as well, okay? Then I've told you that the adrenal medulla is directly innervated by preganglionic sympathetic fiber. So this is a preganglionic one. And then sweat glands are a part of sympathetic pathway, but are innervated by cholinergic fibers. So that's what's the thing that I told you over here. That's, these are the sweat glands, okay? They have the sympathetic innervation, but you see the fiber is cholinergic because it is releasing acetylcholine. So the fibers who are releasing acetylcholine, we call them cholinergic, but the ones that release norepi, epi, or dopamine, we call them adrenergic fibers. So, okay, so this is what it is written at this particular line. Now, I have told you about the nicotinic muscarinic, but there is a lot more detail to tell you that how it works, this mechanism of sodium potassium channels, okay, also the mechanism of G protein coupled receptors through the second messenger system. Also in this book, they have not written the detail of where they are found, like kind of they have written it mixed, but like I'll tell you like which receptor is found at which particular position. So in the next page, we have this mixturation control. I have explained you this really well now, okay, that how you are causing the no urination mechanism that we call urinary retention, okay, by relaxing your detrusor muscle, the receptor is beta 1, and by constricting your sphincters, the receptor is alpha 1, and the parasympathetic is controlled by the pelvic splanchnic nerve, okay. Then um, yes, these are the things which we will be studying in the next lecture basically. So because this book is very high yield, I kind of want to, you know, explain you in better detail to, so that you may grab these concepts and you don't need to learn them by heart or mug them. Once you will understand, you will remember everything. Now before moving on to these tiny details, we have already studied what their receptors do and what is their function, but we have this QINS systems. These all are second messenger systems. So once I will explain you these three mechanisms, you only have to learn that alpha 1 is having this Q thing. So what will it do? Alpha 2 is having this I thing. So what will it do? Okay, you will never need to learn these things then. It will remain in your mind. So tomorrow's lecture will be based on the second messenger system and on the receptors. And then we will move to finally the drugs. Okay, so for today, this is all for pharmacology. I will be updating the time for, maybe I will start the class at 5 for the anatomy, okay? Upper limb anatomy, we will be studying at 5 o'clock. So I need a half-hour break. And then we will be starting upper limb anatomy joints, okay? Yesterday we studied muscles, and today we have to study joints. So I think you get the best of today's lecture. If you have any questions regarding anything, you can ask me in the group, okay, the WhatsApp group. If we have any participant who is new here and is not in the group, you can text me in person. I will add you in there. So here I'm signing off for pharma today. Okay, people, take care. Allah Hafiz. Are you able to hear me? I'm just ending this lecture for today, okay? We will be grabbing anatomy lecture at 5 p.m. Okay. Okay, everybody, take care.